We'll move on to our next speaker, Dr. Shital Muke. She's a project lead and research coordinator at Sangath, India. For the last 8 years, she's been working in the area of global health and mental health, focusing on integrating mental health services into primary health care. Dr. Shital and her team have developed a COVID-19 safety protocol for implementing mental health clinical trials in healthcare settings. Dr. Shital now will present to us on the topic reducing the treatment gap for mental health problems and increasing demand for mental health services, role of lay or non-specialist health workers.
I'll be more talking about the role of the lay or non-specialist health workers in reducing the treatment gap for mental health problems and increasing demand for mental health services. It's well known that the burden of the mental health morbidity is significant at the national as well as the global level. And according to the National Health Survey conducted in 2016-17, the lifetime prevalence for any mental disorder was 13.9%, whereas the current prevalence was 10.6%. And this proportion of the population having the current prevalence of mental disorder, they require actually active interventions. But on the contrary, the treatment gap for the mental disorders range from 70 to 92% for different disorders, including 85% for common mental disorders and 73.6% for the severe mental disorders. So considering this treatment gap, considering this treatment gap and addressing this issue, Sangath adopted the task sharing approach for strengthening the mental health services. And while adopting the task sharing approach, we also did some research around it, and we found there is a strong evidence both for the effectiveness of task sharing as a means of delivering a care for a range of conditions across settings, and for the effectiveness of non-specialist providers and health workers in delivering elements of culturally adapted psychosocial and psychological interventions for common and severe mental disorders. Another set of secondary and primary data which we worked upon indicated that the involvement of non-specialist health workers was very useful in delivering the mental health services to the adults with the depression and anxiety disorder, as well as pregnant women and the adults with the post-traumatic stress disorder, the people with the dementia, and their caregivers. Also, we learned that there is a perceived acceptability towards task sharing approach for strengthening the mental health services and delivering them at community level through the non-specialist health worker, which are again known as the community health workers or the ASHA workers in Madhya Pradesh. Based on these studies, we learned that the task sharing is an innovative way to enhance the access to mental health services, marrying community needs with the health workers' capabilities. So later on, taking this approach forward, Sangath has developed the brief psychological interventions for the lay health counselors, and these interventions had been developed through the premium approach. The premium was initiated in October 2010 with the explicit goal of designing a method for the development of empirically supported psychological treatment, means the treatment which has been developed from the context, within the context where the intervention or the treatment will be delivered. And the important characteristic of the empirically supported psychological treatment was that they were sensitive to the context of the population in which this intervention will be delivered and feasible for delivery by the non-specialist health workers. These non-specialist health workers who do not have any prior training in mental health care, the psychological treatment for depression called the Healthy Activity Program, HAP, and for alcohol use disorder called Counseling for Alcohol Problems, in short CAP, developed in 2 phases. In first phase, we identify the different strategies and modeling of the treatment to develop these intervention packages, and later on we implement these packages in the Goa, state of Goa, and we evaluated understanding its acceptability and feasibility. Then these developed 2 interventions for the depression and the alcohol problems were again studied using the randomized control trial where the community health workers or the non-specialist health workers deliver these interventions to the patients with the depression and alcohol use disorders attending the primary healthcare center in state of Goa. And end of this study, we learned that the lay health counselors who have delivered this treatment to the patients with depression and alcohol use disorder, along with the usual care which was available in the facilities, was helpful to reduce the symptoms of the depression, as well as reducing the frequency of the alcohol drinking among the patients with alcohol use disorder. Then this program called Vishram was implemented by Sangath in the Vidarbha, the part of the Maharashtra. And this was a community level program where the non-specialist health workers and lay health workers were trained trained for the 6 months on delivering or the providing the psychoeducation to the community people. And along with these community health workers, we're working with along with the physicians working at the primary healthcare centers. And this study again was a clinical trial where the 2 group of samples were randomized to the treatment group and control group, where in one intervention group where the non-specialist health worker were meeting to the community people and providing them a psychoeducation, as well as them helping them to access the mental health services available at the primary healthcare centers. And from this study, we learned that the role of non-specialist health worker in increasing the contact coverage and the mental health literacy was significant compared to the control group. Taking forward this work of the Healthy Activity Program and again the community mental health services delivered through Vishram project, the Sangath brought the innovation of digital technology for training the non-specialist health workers. What we did in this phase of our work that has been taken place under the Essence program, where we digitize the Healthy Activity Program in a way that the training which we used to provide to the community health workers through the traditional face-to-face training that was digitized and digitized in a way that can be provided through the mobile phones. In initial phase of digitizing this training, we digitize 1 or 2 modules of the whole intervention, and we test them with the community health workers called ASHA workers here in Madhya Pradesh state.
Where you have 2 minutes.
Yeah, sure. Where we work with the community health workers delivering these, modifying and adapting these interventions for the digital platform. And then along with this training, we also developed a remote coaching remote coaching intervention for the community health workers, when these community health workers will be learning these trainings on the mobile platform. They will be receiving a support from our end where they will be facing any challenges. And through this Essence program, we have trained almost 350 community health workers on delivering the brief psychological treatment for the depression. And based on the work on the Essence, through the Empower project, again, we have trained the 1,000 non-specialist health workers called ASHA in Madhya Pradesh for again delivering the psychological treatment for the depression. Another program called Sartha, where we have developed training for the community health workers, and again it has been digitized, where the ASHA workers can learn that training and screen and refer the patients with the schizophrenia from community to the primary healthcare centers. The learning from our work is enormous in context to the in context to the community health workers, and we have learned and identified that the community health workers or non-specialist health workers are very important part of the healthcare system, who are working in the community with and for community people, and those can be trained and supported through the supervision, and mental health services can be provided to the community people through the community health workers. Thank you.